Great. Let's take one more question back behind, about 4 rows.
Hi, Ellen McCullough from the Bill and Melinda Gates Foundation. One of the key takeaways from a lot of the literature that's been reviewed for this conference and in other places is that the nutrition impacts of agricultural growth seem to take place, in larger populations than smallholders alone through food price effects and rural economic growth, and that they take a lot of time to really happen. So my question is, from the donor perspective, and some people have been asking about, or have been mentioning the impact of what donors are asking for on what they measure. Is it reasonable for donors to expect to see nutrition impacts from project level investments? Is it useful? And does it distract from measuring the other pathways and the longer term impacts?
Okay, thank you very much. We'll stop. Can I ask panelists to be quite snappy in replying? And Daniel and Laura, you both have specific questions. So Daniel, let's start with you, and then we'll go down the panel.
Okay, I'm only going to answer a couple and leave the others. One was, did we measure care practices and look at things like effects on breastfeeding and things like that? We actually had, because there was a big behavior change component of the study, on the orange sweet potato study, we did measure both changes in knowledge and in practices, both at baseline and follow-up, and we did see some learning through the project. But part of what we learned was that the messages that were delivered were, in some cases, more complex than they should be, and that was one of the areas where we thought some fine-tuning could improve both kind of getting the most important messages across and cost effectiveness. Was the low diffusion into control groups too low? We did design the study so that we didn't have control farmer groups kind of immediately across the street from others. In the way we did the sampling, we were careful to make sure that we didn't have two communities kind of right on top of each other that were treatment and control. So that was one of the reasons for low diffusion rates. And the project implementers understood that this was a study, so they were careful not to kind of tread into the control areas. Whether or not that ended up being the natural diffusion of those areas was kind of low then. We're going to learn more about that when we go back in Uganda later this year, where we have a sample of communities that are bordering the original areas, and we're going to see what diffusion rates are there now 8 seasons later. Thanks.
Sure. Okay, so just to respond to the 2 questions addressed to me, to begin, regarding breastfeeding practices, we are looking exhaustively at that. I come from that background, so we're taking that into careful consideration. If anything, I have a lot of farmers saying, why are you asking about breastfeeding practices? In terms of time allocation, we have done some of that, but actually I would like to take that comment into consideration and maybe integrate a couple more questions into the survey. Thank you. Finally, wasting, obviously we're collecting both height and weight, so that will be a consideration. Regarding targeting the poorest of the poor, this, again, as I alluded to this in the presentation about the construction of the comparison groups, we haggled about this for a long time. Kickstart, again, was sort of insistent on having it be a representative sample of pump buyers, but I can tell you that we have a range. We do have very poor farmers who are saving money and investing in these pumps. And they have a new program now called a layaway program, in which very poor people can put money aside over a long period of time and buy these pumps. Regarding non-participating households, we'll be capturing that as well. Not directly, we won't interview those people, but we will have questions regarding labor on the farms and all of that.
Great. Derek.
Yeah, just to pick up a couple on Ellen, I think, raised a very good question about doing project-level impacts. And in the case of agricultural research, even though donors often require you to do project-level impacts, it doesn't really make sense. The impacts are much longer term, and in any event, agricultural research is a very uncertain event. You get a lot of dry holes in agricultural research, but you add it all up, and it's usually a very positive result. So I think this is something we have to continue to work on, is looking much more strategically at long-term portfolio or program of work rather than just looking at individual projects. And even though I know my chair is from a donor, I think it's something we have to keep working on the donors. That evaluating agricultural research is a little bit different. In terms of lessons learned and diffusion, I think going back to Javier's question, in terms of learning, it's not just learning about that particular intervention. I think learning can be in a more generic sense. And I think, for example, the work we did on policy research and looking at impacts of policy research, and including the pesticide work, I think there's a lot of learning out of that as to how the impact pathways by which evidence on the relationship between agriculture and health can be used in policy processes. So I think that's a more generic type of learning than for a specific project. And finally, in terms of dissemination of those results, our most popular publication in SPEAR, the Standing Panel for Impact Assessment, is a 2-page brief that goes out to all of the stakeholders. We put out half a dozen of those a year, and I think we get much more traction. They're all based on peer-reviewed journal, but we've condensed them down into something that's reader-friendly and with the main messages.
On learning and sharing the results, I think it very much depends also who is your target audience. Is it sort of the international community? Is it researchers? Is it international policymakers sort of level, or is it the actual program type of managers in that in charge of that particular intervention? And I think one needs to tailor the information and the communication and the means of doing it according to those different groups. Now, for example, I mentioned earlier the systematic reviews. I think one thing is very important is that those individual pieces of evidence that we have, that they get translated and summarized in one place. So I think systematic reviews, for example, play an important role in summarizing lessons learned around key questions. But nevertheless, these reviews again need to get published in a way that are understandable, and actually that is one of our big challenges. And we are at 3IE, we are making sort of policy briefs out of those systematic reviews. The other issue is whether it's really publications that are the way to share information. And if your target group, if you actually want to influence policymakers, make them change decisions regarding programs based on information, then there are other ways. There are direct meetings. There are oral presentations, etc. You need to identify the people that will deliver the message so that the policymaker listens to it. And this is what I mentioned by our policy influence plans, that this is beyond just packaging the information. It's also finding the key movers and shakers. Thank you.
Yeah, just concerning the learning and sharing briefly, the issue of how you translate that information, as my colleagues have just said, is actually quite important depending on who your target audience is. But I think the challenge also with the evaluation is, in some cases, in most cases, I would say, evaluation is also seen as more extractive, really. Information goes out. It is not circulated within the communities. So people who actually are supposed to benefit from that evaluation to change their practices, to change how they do things, sometimes it takes a year before that information comes back, and it may not come to those same people. It goes to a different. So how do we effectively make sure that evaluation results and the learnings from that are actually part and parcel of the programming process in the community? We've tried to pilot a bit of that in World Vision using some simple methods. using lot quality assurance sampling, LQAS, for some small programs, just to try and see, can we involve program staff in some of these kind of assessment and evaluation to try and see whether they can learn from that. While we're doing the major evaluations, when you get an external evaluator, that goes out, and by the time it comes back to do dissemination and all that, sometimes the context is different and things have changed. And sometimes really the same people who gave the information are not the same ones receiving. So it's always that challenge of how do you do that. Yeah, there's an understanding, some NGO evaluations sit on the shelf, but a lot of academic evaluations sit in universities. I worked in northern Kenya. There was so much done by universities until I went to study in the US, and I found so much information about programs I was doing, but I didn't have that information when I was doing them, but they were there in the shelves in the university. So it's a challenge. How do you bring that information back to actually utilize in the community and to the program people? The other piece about investment, I think somebody from Melinda gets asked about the investment. The issue of investment in agriculture, do you get the results now? It's mostly long-term. And I think that's the challenge is the investment, donors, there's a bias for hardware rather than the software. A lot of what we want, a lot of the changes you want to see in agriculture staff or in agriculture programs to bring about nutrition outcomes are really software type of things, training and all that, which are not very easily fundable. A lot of the hardware stuff which is fundable is the productivity, which is what we are saying does not necessarily translate to nutrition. So how do we kind of bridge that gap? There's also the need for donors to also be sensitive towards nutrition-sensitive programming, whereby you're not just funding hardware, but there's also that aspect of funding as much to do with how do you train people who are either not nutritionists or who don't have enough information to assess nutrition outcomes. Yeah.
Briefly, researchers are key communicators, and we have found that they haven't necessarily realized that always. So just a little announcement also is that we have our impact evaluation conference this year in Cuernavaca in Mexico in June. It's called Mind the Gap, From Evidence to Impact, and among many other areas, agriculture will be a very important theme, and there will be clinics that will be training researchers on how to communicate findings.
Thanks. Thanks to all the panelists for comments to those questions. I do wish we had another half hour, because although some people I can see are starving for caffeine, but there's lots more questions. I think, ladies and gentlemen, what we've heard is that looking at the topic of this conference, leveraging agriculture for improving nutrition and health, actually we have underinvested in understanding that dimension and the evaluation side. So we've heard a compelling case for investing more and looking at the nutritional health outcomes for agriculture more. We've also heard some really good examples of how it can be done. We've identified that looking across the causal chain is really important, that there are really some tricky methodological issues and we need methodological sophistication to approach these questions, but also communicating the results out to a variety of audiences in a way that can be understood and translated into programming is really important as well. I think a rich menu for action over the next couple of years. I would like to remind you that there's coffee and tea and the knowledge fair out in the Rani Bagh. The next plenary session starts at 3 o'clock sharp, so please be on time. And I'd like to invite you to join me in thanking the panel for some really good presentations.